Here are 15 Puerto Rico Medical Board-style clinical vignettes focused on hematologic disorders, anemias, coagulopathies, and hematologic malignancies, each with 4 answer choices and explanations. Hematology clinical vignettes, anemias, coagulopathies, and hematologic malignancies. Anemias. 1. Iron deficiency anemia. A 32-year-old woman presents with fatigue, pallor, and pica. Labs show low hemoglobin, low MCV, low ferritin, and high TIBC-ST. What is the most likely cause? A. Hemolysis. B. Chronic blood loss. C. Vitamin B12 deficiency. Answer B. Chronic blood loss. Explanation: iron deficiency anemia is commonly caused by chronic blood loss, e.g., menstruation, GI bleeding. 2. Vitamin B12 deficiency. A 68-year-old man presents with fatigue, glossitis, and paresthesias. Labs show macrocytic anemia with hypersegmented neutrophils. What is the most likely cause? A. Autoimmune destruction of parietal cells. B. Chronic kidney disease. C. Sickle cell disease. D. Lead poisoning. Answer A. Autoimmune destruction of parietal cells. Explanation: pernicious anemia is due to B12 deficiency from autoimmune destruction of gastric parietal cells. 3. Sickle cell disease. A 10-year-old African-American boy presents with severe bone pain in his legs and hands. He has a history of frequent infections and dactylitis. What is the underlying pathophysiology? A. Autoimmune destruction of RBCs. B. RBC membrane defects. C. Hemoglobin polymerization and vasoocclusion. D. Enzyme deficiency in heme synthesis. Answer C. Hemoglobin polymerization and vasoocclusion. Explanation: sickle cell disease results from HbS polymerization, causing vasoocclusive crises. 4. G6PD deficiency. A 25-year-old man develops jaundice and dark urine after taking sulfa drugs. Labs show Heinz bodies and bite cells on a peripheral smear. What is the underlying cause? A. Autoimmune hemolysis. B. Defective spectrin. C. Oxidative stress from G6PD deficiency. D. Increased RBC membrane rigidity. Answer C. Oxidative stress from G6PD deficiency. G6PD deficiency leads to hemolysis under oxidative stress, e.g. fava beans, sulfa drugs. 5. Hereditary spherocytosis. A 16-year-old boy presents with jaundice, splenomegaly, and a positive osmotic fragility test. What is the best initial treatment? A. Corticosteroids. B. Iron supplementation. C. Splenectomy. D. Hydroxyurea. Answer: splenectomy. Explanation: hereditary spherocytosis is treated with splenectomy to prevent RBC destruction. Coagulopathies. Hemophilia A. A 12-year-old boy presents with spontaneous joint bleeding and an increased PTT. His PT and platelet count are normal. What is the most likely deficiency? A. Factor 7, B. Factor 8, C. Factor 9, D. von Willebrand factor. Answer: B. Factor 8. Explanation: hemophilia A results from factor VIII deficiency, leading to increased PTT. 7. Von Willebrand disease. A 25-year-old woman has easy bruising, epistaxis, and prolonged bleeding after dental extractions. Labs show increased PTT and prolonged bleeding time. What is the best initial treatment? A. Heparin. B. Desmopressin, DDAP. C. Vitamin K. D. Fresh frozen plasma. Answer B. Desmopressin, DDAVP. Explanation: DDAVP releases stored VWF from endothelial cells, improving clotting. 8. Disseminated intravascular coagulation. A septic ICU patient develops bleeding from IV sites and petechiae. Labs show low platelets, prolonged PT-PTT, and elevated D-dimer. What is the most likely cause? A. Autoimmune platelet destruction. B. Consumption of clotting factors and platelets. C. Vitamin K deficiency. D. Factor VIII deficiency. Answer B. Consumption of clotting factors and platelets. Explanation: DIC leads to widespread clotting factor depletion and bleeding. 9. Immune thrombocytopenic purpura, ITP. A 5-year-old girl presents with petechia and a low platelet count after a recent viral infection. PT and PTT are normal. What is the best initial treatment? A. Plasma exchange. B. IVIG or corticosteroids. C. Rituximab. D. Heparin. Answer B. IVIG or corticosteroids. Explanation: ITP is an autoimmune platelet destruction disorder treated with IVIG or stellogic malignancies. 10. Acute lymphoblastic leukemia, ALL. A 4-year-old boy presents with fever, bone pain, and pancytopenia. Bone marrow biopsy shows 20% lymphoblasts. What is the most likely diagnosis? A. Acute myeloid leukemia. B. Acute lymphoblastic leukemia. C. Chronic myeloid leukemia. D. Hairy cell leukemia. Answer B. Acute lymphoblastic leukemia. Explanation: ALL is the most common childhood leukemia characterized by lymphoblast proliferation. 11. Chronic myeloid leukemia, CML. A 50-year-old man presents with fatigue, weight loss, and splenomegaly. Labs show marked leukocytosis with a left shift. What genetic mutation is associated? A. JAK2 mutation. B. BCR-ABL translocation. C. MIC amplification. D. PML-RARA fusion. Answer B. BCR-ABL translocation. Explanation: CML is associated with the Philadelphia chromosome, T22 BCR-ABL. 12. Multiple myeloma. A 65-year-old man presents with bone pain, hypercalcemia, and recurrent infections. Labs show monoclonal IgG spike and Bence-Jones proteins in urine. What is the most likely diagnosis? A. Waldenstrom's macroglobulinemia. B. Chronic lymphocytic leukemia. C. Multiple myeloma. D. Hodgkin lymphoma. Answer C. Multiple myeloma. Explanation: multiple myeloma features plasma cell proliferation, bone lesions, and hypercalcemia. Would you like additional vignettes